In the United States, we're often told to shop around for healthcare, like it's as simple as comparing prices on a flight or a pair of shoes. But what happens when you can't even see the price tag? Healthcare price transparency was supposed to fix that. Laws have been passed and rules put in place requiring hospitals and insurers to clearly publish their prices. Yet for most patients, the system is still opaque. The information is hidden in technical jargon, buried in PDFs, or presented in formats so confusing they're essentially useless. What this really points to isn't just a lack of data, it's a lack of trust. When patients can't understand what something costs until after it's done, when they're billed for procedures they didn't know they agreed to, or discover that the same service costs 10 times more at the hospital than at a nearby clinic, how can trust survive? A Return to Healing calls this out. We believe price transparency isn't just about information. It's about restoring the broken relationship between patient and provider. It's about clarity, consent, and fairness. Transparency should empower patients to ask questions, to compare care options, and to plan without fear. But that only works if the information is accurate, accessible, and human. And here's the hard truth. The system doesn't benefit from transparency. Many hospitals and insurers are reluctant to comply with the law because ambiguity is profitable. Surprise bills, inflated costs, administrative games, they all generate revenue. But that doesn't make it right. We believe that restoring clarity in pricing is a necessary first step toward a healthcare system that values healing over billing, one that puts patients first, not profits, and one that holds providers accountable, not just to legal standards, but to ethical ones. Price transparency is not a silver bullet, but it's a start. And it's a demand we should all be making. This is how we return to healing. Read the full blog and learn more about A Return to Healing by following the link in the description. Explore the book, reclaim the conversation.